My name is Alexis Newcomb. I'm in Group 4 with Rachel Negron and Michelle Palma, and I will be talking about diabetes and hypoglycemia. Diabetes mellitus is an autoimmune metabolic disorder characterized by hyperglycemia, or high blood glucose level. The condition is caused by a reduction or an absence of the production of insulin by the beta cells of the pancreas, or defects of the insulin receptors. Insulin is a hormone that aids in the conversion of sugar and starches to a form that the body can transport to the cells to utilize for energy. There are three types of diabetes. 5 to 10% of all diabetics are type 1. They have an absolute lack of circulating insulin and they are dependent on supplemental insulin for survival. On the left corner, you can see a picture of a man with an insulin pump. On the left side of his body, he has a sensor, and on the right, he has a pump. The insulin is housed inside the pump in a little cartridge called a reservoir. The insulin travels into the body through a flexible tube that ends with a tiny needle called a cannula inserted just under the skin. On the right side of the slide, you see an injection of insulin. "90 to 95% of all diabetics are type 2. Type 2 diabetes is the inability of the body to produce sufficient amounts of insulin or to properly use the insulin that is produced. Type 2 diabetes is managed by diet, oral medications, or injectable medications. Patients tend to be larger and overweight. Gestational diabetes occurs in 2 to 5% of pregnant women. It's characterized by glucose intolerance with initial onset during pregnancy. If left untreated, it can cause significant developmental disturbances to the fetus and result in some big babies. To prevent any emergencies from occurring, the clinician should schedule early to mid-morning appointments for diabetics. These appointments should be short, and the clinician should instruct the patient to continue normal dietary intake before the appointment. The clinician should also check the glucose levels prior to invasive procedures and inquire about medications, recent meals, problems with their eyes, feet, and legs, and the average hemoglobin value. If your patient starts experiencing tachypnea, drowsiness, dehydration, poor skin turgor, warm dry skin, increased thirst, muscle weakness, severe fatigue, nausea, vomiting, blurred vision, fruity odor on breath, hypotension, or tachycardia, they may be experiencing diabetic ketoacidosis or DKA. Treatment of DKA would be to first recognize the signs and symptoms, evaluate the level of consciousness, position the patient supinely, and activate the calves of CPR. After checking the circulation, airway, and breathing, implement the appropriate emergency protocol for DKA. Monitor the patient's blood glucose level. If you're unsure of whether it's DKA or hypoglycemia, administer 15 grams of oral glucose. Then administer 4 to 6 liters of oxygen a minute if needed. Throughout this, you should be monitoring their vital signs. Refer to EMS for administration of insulin. If your patient is hypoglycemic, they will have a blood glucose level below 50 milligrams per deciliter. To prevent this, ensure that your patient hasn't missed any meals, discourage irregular eating, and discourage the consumption of alcoholic beverages, along with increased exercise without increasing their insulin dosage. Signs and symptoms of hypoglycemia include confusion, seizures, coma, dizziness, weakness, syncope, headache, intense hunger, cold skin, clammy skin, profuse perspiration, irritability, and aggressive behavior. To treat this, position the patient upright, activate calves, administer 20 grams of glucose orally, monitor their vitals, and administer 4 to 6 liters a minute of oxygen.